Hello once again, and welcome to HRSCO Online, your online resource for education on podorthics and orthotics. In the last two segments, we looked at different aspects of wound healing, and this is the third and final part of the series. In parts 1 and 2, we specifically looked at using the total contact cast and also using other AFOs, removable AFOs, instant total contact casts, and crow walkers, which are all beneficial. One of the main uses of the AFO is that it limits ankle joint dorsiflexion, reducing forefoot pressure in third rocker or in the propulsive phase of gait. However, not every patient needs an AFO, and in less severe cases, there are other modalities that can be used. One device that can be used to offload a patient forefoot if they're suffering from an ulceration is a surgical or half shoe. This can be worn so that the pressure is felt only by the midfoot and the rear foot, whilst the forefoot in some way is suspended. This has the benefit of being easy to apply, very cost effective. However, not every patient that gets these shoes is compliant. A favorite offloading trick for podiatrists is to use felted foam, where they pad the plantar aspect of the foot and cut out an aperture for the localized area where the ulceration has occurred. This can be very effective. Felted foam does need to be reapplied on a sequential basis. And we also need to watch out for what's termed an edge effect, where the rim of the aperture can also become a site of further ulceration if we're not careful. More commonly, in most of our practices, we find that foot orthotics, custom-made inserts, and extra depth shoes, either off the shelf or custom-made, are applied to our patients in order to treat, to some degree, wounds, open wounds, but also more importantly to prevent further ulceration as the patient returns to a normal lifestyle. The typical orthotic used for a diabetic patient will look something like this. It's a multi-density EVA insole, and it will have a 35 durometer base material and with a soft, low friction top cover such as pink plastozote or P-cell. These can also be formed to the foot with depressions or relieves for areas of high pressure. Very often, shoes are also dispensed to this patient population. Custom shoes have plenty of room in the toe box. They'll also have a removable, custom-made extra depth insole. And very often, several pairs of insoles will be provided with the shoe to ensure that the patient doesn't break down or wear the insole over the course of the year for which the shoe is being dispensed. Enhancements can be made using rocker soles, sole stiffeners, and various other changes to the prescription in order to reduce pressure at localized areas. The one question that remains is patient compliance. These devices can be used if there's a high degree of probability that the patient will follow your treatment protocols. For further information on wound healing, please refer to our website, HRSCO.com, and click on the Education tab. Thank you once again for joining us.